Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. In this video, we're going to talk about TB, tuberculosis, laryngeal cancer as well as lung cancer. So TB, what is TB? TB, this is an infectious disease in the lungs that is caused by a microbacterium tuberculosis. Some signs and symptoms of this include cough for more than 3 weeks, late night sweats, pleurant or bloody sputum, lethargy or unintended weight body loss. How do we diagnose this? So we normally do quantifier, the blood test, which is the golden quantifier. We can do a Mount 2 test, which is a skin test, a PPD, and it's normally read between 48 to 72 hours. So the area of induration, which is the hardness, should not be more than 10 milliliters, because if it's more, it's indicative of TB. And if a person is immunocompromised, they might get a 5 millimeter induration, which is positive of TB as well. So people with a BCG, which is a vaccine, mostly people who are from Africa and other countries, they normally get a BCG vaccine. They always test positive they normally test positive, which is a false positive to PPDs. That's why they end up doing chest x-rays for them. So also we can do a chest x-ray to diagnose TB as well as sputum culture. And with the sputum culture, we do an acid-fast basal culture and we use 3 early morning sputum samples. So nursing care for patients with TB include when a patient is suspected of TB, when they come in and we suspect this patient is positive of TB, before even we know they're positive, we put them in a private room with a negative airflow, because remember TB is airborne. If you leave them there, it's going to fly all over and everybody's going to have this TB. The nurse is to wear an N95 mask when in the patient room to prevent, because it's airborne. And if the patient leaves the room, they need to wear an N95 mask. We need to screen the family for TB. The patient, whoever they were living with, the family, spouse, whoever they are living with, they need to be screened for TB as well. We need to teach the patient that sputum samples will be needed every 2 to 4 weeks and will no longer be considered infectious after 3 negative sputum tests. So we'll put this patient here, we'll treat them, but TB is a long-term treatment and most of the time compliance is an issue because this patient will be on medication for like antibiotics for 6 to 12 months, all right? And you need them to comply with this antibiotics so they're not resistant. So some of the antibiotics we'll see this patient get is isosonide, rifampin, and ethambutolol, which can do liver damage. And when they're on medication therapy, we need to teach this patient one thing: to avoid alcohol during the therapy, right? Or even avoid alcohol as well. And also remind them to do what? To comply with ABT administration therapy to avoid resistance. So laryngeal cancer. Laryngeal cancer is malignant cells occurring in the mucosal tissue of the larynx. It's more common in men between the ages of 50 to 70. What are the causes? Include radiation exposure, chronic laryngitis, and straining of the vocal cords, as well as smoking. So signs and symptoms of this include weight loss, anorexia, unexplained weight loss, right? Hard, immobile lymph nodes at the neck. The patient could have dysphagia, dyspnea, coughing, persistent sore throat, and as well as we'll see hoarseness and extended longer than 2 weeks. How do you diagnose this? We can do MRI, X-ray, as well as CT scan. We can do a direct laryngoscopy with a biopsy, right, to get that sample so we can diagnose this patient if they are positive or laryngeal cancer. We can also do a bone scan and position emission tomography, which is a PET scan. What are our interventions? With this patient, we always maintain, it's in the larynx, it's the airway. We maintain a patent airway. We always have the swallowing and nutrition precautions because they can't swallow well. We need to watch for respiration and maybe we'll need to tweak the nutrition because it could be an issue for them to swallow. Pain management is key because whatever the pain the patient says they are they're having, that is the pain we need to treat them for. And we always administer medication. Some therapeutic measures would include either a partial or total laryngeectomy and as well as radiation therapy at that area. So we teach these patients too how to use various communication methods, stomach cleaning if they end up with a trach, right? Swallowing maneuvers, how to swallow well as we introduce them with speech therapy because they will have an issue with speech. Lung cancer. So lung cancer is one of the leading causes of cancer-related deaths for both men and women in the US. So it's primarily a metastatic disease, most commonly occurs between the ages of 48 and 70. What are the common causes? Of course, smoking, either first or secondhand smokers, radiation exposure, chronic exposure to inhalants and irritants, as well as an older age, right? Signs and symptoms include a chronic cough with dyspnea, hoarseness, fatigue, weight loss without any reasoning behind it, anorexia, and remember the definition of anorexia is lack of appetite, clubbing in the fingers, chest wall pain, and this clubbing in the fingers, remember, we're not perfusing like COPD patients, so low oxygenation could lead to that clubbing fingers. How do you diagnose this? We can do the CT scans, chest x-ray. We can do a CT-guided needle aspiration. We can do a bronchoscopy with a biopsy. We can do a TMN system of staging. So the TMN stands for T is tumor, the nodules, and how further it has metastasized, right? So as a nurse, what are your intervention? It's respiratory, right? We are making sure that patient has a patent airway. We always have the suction as indicated by the assessment, right? Suctioning a patient is not every so often, right? Is as needed. You assess, then suction. We monitor the vital signs, of course, our pulse oximetry, nutrition status. Since it's our airway, it's our mouth, that's how we eat. We have to see if this patient is getting sufficient nutrition and they're losing body weight. So we need to watch that as well. High Fowler's position to open that airway lets them breathe. Of course, emotional support, because this, it's not a good prognosis or a diagnosis. We assess and treat stomatitis on the mouth, right? Dry mouth, any kind of, irritation to the oral cavity. We ensure protection for immunocompromised clients because once this patient go into chemotherapy or radiation, they become immunocompromised, so we always prevent them from getting infections. So medication, they normally on chemotherapeutic agents as well as opioid narcotics for pain. So this patient could be referred to palliative care for medication and thoracics to empty the fluid, right? Get the fluid out of the thoracic cavity so the patient lung can open to expand to expansion. We can do surgical interventions like we can remove the tumor, we can do a lobe removal partial, or we can do radiation, even a wedge resection. So these patients, we need to teach them how to take their medications. We need to help them prevent constipation and management, right, of constipation, because on opioids, it does what? It's a risk for constipation. So mouth and skin care, right, and nutrition also for them. Since it's your mouth, we need to ensure this patient is getting sufficient nutrition to heal. And we always refer these patients to respiratory services, radiation, rehabilitation, nutrition, and hospice if appropriate. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.